my name is Jamie Corsa. Today I will be demonstrating administering oral medications. So right now I am outside the client's room. I have just performed hand hygiene. I am in the med room right now. So what I'm going to do is I have my MAR, which is Medication Administration Record, and my health care provider orders. What I'm going to do is just make sure that everything matches up. So my patient's name is Shirley Cost, age 54, female. MR number matches, account number, and date of birth as well, 5/14/64, 5/14/64. Perfect. So now I will go down to our medications that we will be administering at 0900. So first is Refresh Plus Lubricant Eye Drops, 1 drop both eyes 3 times a day. Refresh Plus Lubricant Eye Drops, 1 drop both the eyes 3 times a day. Then we have our fentanyl 50 micrograms per hour transdermal patch twice a day. Fentanyl 50 micrograms per hour transdermal patch twice a day. We then have Augmentin 600 milligrams by mouth twice a day for 7 days. Augmentin 600 milligrams by mouth twice a day for 7 days. We will also have to do a dimensional analysis, which will actually equal out to 7.5 milliliters. Then we will go down to our ibuprofen, 800 milligrams by mouth every 8 hours, as needed for pain. Ibuprofen, 800 milligrams by mouth every 8 hours, as needed for pain. Then we have the digoxin, which is 250 micrograms by mouth daily. Digoxin, 250 micrograms by mouth daily. We will also do a dimensional analysis for that, and that is 0.25 milligrams. We then also have Paxil, 20 milligrams by mouth daily. So now that I have made sure everything is good, I am now going to just read off again and make sure that I have all of my stuff right here. So first I will check for my Refresh Lubricant Eye Drops. Then I will go down to my fentanyl patch. Then we have our Augmentin, ibuprofen. We have our digoxin, and we have our Paxil. So now that I have everything out, I'm still outside the patient's room, so first I need gloves. Put some gloves on. Okay, so I'm going to take the tray out, and I want to make sure that when I am measuring out all my medications, to put this on a tray here. So the first thing is going to be our Refresh Plus Lubricant Eye Drops, which we're just going to take this out. This is going to be for her dry eye. Then we have our fentanyl 50 micrograms per hour dermal patch. We then have our Augmentin, which is 600 milligrams, but with our dimensional analysis, again, it's going to be 7.5 milliliters. So to do this, you want to make sure you shake it up, and you want to cover up the area where it says all the information, the label. So then you want to get it eye level. Want to make sure that the bottom of the meniscus is at 7.5, which it is. Okay. Then we are going to do our ibuprofen, 800 milligrams. This right here is 400 milligrams, so we want to make sure that we do 2 of these. digoxin right there, and our Paxil. Okay, and then we will throw in some wipes, as well as a cloth. Okay. Okay, so now I will go into my patient's room, knocking on the door before I enter. And if the patient is laying down in bed, I will go in and I will lift up the bed to where they're sitting, but since she's already in a sitting position, she's fine. So I will walk in. Hi Shirley, how are you today? Good, good. So I have some medications here for you, but before you take those, I am just going to verify your name and date of birth right here on your wristband. Make sure it just matches up with my papers here. So Shirley Cost, 54, date of birth, 5/14/64, perfect. And also your allergies, okay. Promethazine and codeine, perfect. Okay, that matches up here. Okay. So today, Shirley, we are going to first gonna give you, we'll start with your Augmentin, but before that, I know that you said you were in pain earlier. Can you rate your scale of pain, about 1 to 10, 10 being the highest, 1 being the lowest? A 6, okay, yeah, for that knee pain, okay. I did bring in some ibuprofen for you, but before we do that, you are getting digoxin, and that is for your heart arrhythmia, so we just want to make sure that your pulse is in the right area. So I'm going to just listen to your apical pulse here, make sure everything's okay for 30 seconds. Okay, perfect. So I got 40 beats for 30 seconds. So since we want to listen usually for a full minute, that'll be 80. So you are in perfect range. So first I'm just going to have you take your Augmentin. This is for your bacterial infection that they found. You'll be taking this about twice a day for 7 days. So here's this. And some water for you. Okay, yeah, it doesn't taste very good, does it? Okay, so next, I wanted to ask you, did you want to take all these pills, the medications in one, or would you like to take them separately? Okay, all in one's fine, perfect. So we'll just make sure we have our ibuprofen, 800 milligrams. Okay, here, so there's 2 in there. We then have our digoxin right here. 0.25 milligrams. Perfect. We then have our Paxil, which is 20 milligrams. So the digoxin is for your heart arrhythmia, like I mentioned earlier. Your Paxil is just to help with some anxiety, and then that ibuprofen is to help with that knee pain that you're having. Okay, so I have all of that here, and so you'll just want to take a big gulp of water. Okay, perfect. Okay, so now we are going to administer some eye drops here. I am going to put some in 1 drop in both eyes for that dry eye that you've been having. So before I do that, I just want to make sure if my patient has any buildup around their eye to take a washcloth and do that. Shirley does not, so I will pull down her conjunctival sac. I will pull down her bottom eyelid and place this in her conjunctival sac on both eyes. Want to make sure that she's leaning up, And I will also give her a tissue, so just in case anything runs down the eyes or anything, she can wipe it off. Okay. So now I am going to put on your fentanyl patch. This is going to help with that chronic pain you've been having. So what I want to do first is I'm going to take off your the last one that was put on, so it's right here on the right upper chest. And I want to take this and clean it off. Okay. And then I would change my gloves. Purpose of the video, I'm not going to, but this would be a great time before I put on the new patch. And before putting on the fentanyl patch, I want to make sure that with a permanent marker, I mark down time, which is 0900, and then the date, and also where it will be going. Since it was on the right upper chest, I'm going to put it on the left upper chest. Okay. And always with this, you don't ever want to put a fentanyl patch in the same place. So like I said, since it was on the right, I will be putting it on the left here. For you. Okay, Shirley, so we are all done administering your medications. I'll come back in about a half hour to make sure, check on you and your pain you've been having. Before I leave, is there anything that I can get you? Did you need to use the restroom or another drink of water? No? Okay, all right. So I will be back in about a half hour. So leaving my patient's room, I want to perform hand hygiene and also then document everything that happened in the room in her chart.